Certainly. Let's delve into the details and ensure we cover all aspects thoroughly, including the diagnosis and any additional information from the provided images. Okay, let's walk through this interesting case together. We're examining a series of axial MRI images of the liver, all captured at the same level. The standout features here are two distinct focal liver lesions, each measuring approximately 3 to 4 centimeters in diameter. On the T2 weighted images, these lesions present a relatively uniform high signal intensity. This is an important characteristic to note. When we switch to the non-contrast T1 weighted images, we observe that one of the lesions shows the Indian ink artifact, which is typical of out-of-phase images. This artifact indicates a loss of signal at the interface of tissues with different magnetic properties, but in this case, there is no significant loss of signal intensity, which is notable. Next, let's consider the postgadolinium enhancement phases. These images reveal that the lesions exhibit progressive centripetal opacification, starting at the margins and becoming more homogeneous and uniform as time progresses. This type of enhancement pattern is often seen in benign lesions. Additionally, there's no evidence of a central scar on either the T2 weighted images or the post-contrast images, which is a reassuring feature. The margins of the lesions are rounded and well-defined, with clear demarcation from the surrounding liver parenchyma. The background liver tissue itself appears homogeneous, with no evidence of cirrhosis, and it's worth noting that the spleen is not enlarged in these images. To sum up, these imaging findings point to two focal lesions in an otherwise normal-appearing liver, with no signs of cirrhosis or other liver abnormalities. The native tissue signal and the post-contrast characteristics of these lesions strongly suggest they are benign. So what's our diagnosis here? Based on the imaging characteristics we've discussed, these findings are highly suggestive of multiple benign cavernous hemangiomas in the liver. Cavernous hemangiomas are quite common benign liver lesions and are often discovered incidentally during imaging for other reasons. They typically appear as well-defined lesions with high reflectivity on ultrasound located in the periphery of the liver. On CT and MRI, they often show a distinctive filling-in pattern from the periphery towards the center on delayed phases, consistent with benign features. Now, it's important to discuss why we reach this conclusion and what other factors we consider. When describing liver lesions, it's crucial to note whether they are solitary or multiple, their size, location, and whether they display a central scar. Additionally, the enhancement characteristics across different imaging phases can provide valuable clues. The background state of the liver, such as the presence or absence of cirrhosis, significantly influences the differential diagnosis. For example, a new solitary lesion in a young patient on oral contraceptives might suggest a benign adenoma, whereas a similar lesion in an older patient with chronic liver disease might raise concerns for malignancy, such as hepatocellular carcinoma. In cases like this, where the imaging findings are typical for benign lesions, the confidence in the diagnosis is high. However, if there are any atypical features or if the clinical context raises concerns, further evaluation may be warranted. This could include additional imaging studies, follow-up exams, or even a biopsy, depending on the specific clinical scenario. Finally, it's worth mentioning that cavernous hemangiomas, while benign and often asymptomatic, can sometimes present with atypical features that make them appear nonspecific on imaging. However, the typical features we see here on CT and MRI, including the filling-in pattern from the lesion's periphery, are consistent with the benign nature of these lesions. The risk of complications is generally low, and intervention is rarely needed, unless the patient experiences symptoms or complications arise. So, in conclusion, it's essential to approach each case with a comprehensive and systematic mindset, integrating all the imaging findings with the clinical history and other available data. This holistic approach ensures accurate diagnosis and appropriate management. For those interested in learning more about such cases and radiology in general, I highly recommend subscribing to Radiology Made Easy on YouTube. It's a fantastic resource for simplifying complex radiological cases and making them accessible for learning and professional development. Thank you for joining me in this detailed exploration, and remember, in radiology, every detail matters.